All right, so who was here on Tuesday morning? All right, everyone was. Great. Thank you. If you recall, when I stood up and made a few comments, I spoke and said, if you have one thing that you would like to recommend that we do over the next year, please put it into the app and let us know. There was a question put on the app. So we're here to share with you what the answers were and what we're going to do about it. So turn it over to Ann for the common themes.
Go
ahead. There were a lot of responses, so thank you. And
no, we really do appreciate your engagement, and the themes were consistent with what we've heard from the stage as well, so we know we're getting to the right place. One of those being more access to the technology for our veterans, including more diverse access to the technology. So we'll certainly be leaning into being mindful for that. Also, expansion in training, and that includes both transforming how we currently learn to training in immersive technology, but also providing training for our staff and our veterans on how to use the technology. And then finally, access to more and better data about how the technology is working and impacting our healthcare system.
all right, so after many discussions and deliberation around a potential number of increase in headsets, we are going to say out loud that we're taking it from right now, as mentioned by Dr. Clancy, 1,200 headsets out there to 10,000 headsets. And thank you to Dr. McDougall, who already has mentioned purchases, and Ms. Gia Lee, who's at the San Francisco VA Director, and others out there that have already communicated with me, Matt Rogers from the Clinical Resource Hubs. We're going to help support that, coordinate that. Number two, and it could go beyond 10,000, but we're going to hit that as at least a floor level and continue to strive for higher.
The attorneys have taught me to say including but not limited to.
But not limited to. Nice, Ann. A lot of creative work. So number two is training. We are also very excited to think about what that will look like and committed to standardized training, both in person and virtual. And the in-person training, I'd like to announce that we are partnering with, this is more maybe a VA thing to know, but NOLA University. NOLA University is in New Orleans. It is a vehicle that we use to bring groups together in a multimodality way, to be able to train groups. So we are committing to that, as well as some standardized patient and provider trainings in a virtual environment. And last but not least, we are looking at data. And this is a complex one, but we are committing to increasing the amount of data available for patients and for the provider team, so we continue to drive and understand the impact of where we're headed and where we're going. And that includes easier data out of the headsets, data that we can put into manageable bites, looking at notes that are standardized in given clinical areas such as pain, so a lot of what Caitlin had mentioned, and we can then continue to drive forward and learn what this means for our veterans. So, Ann, let's conclude, and I'll turn it back to you in a moment. That at the center, as Dr. Clancy said, of all this is what will the veterans want, and how can we make our organization better to improve the lives, as I say, of veterans and staff every day. And these are our commitments from our office. It will take a community. We're going to engage with you all in the community of practice that we have, and we'll be looking for other ways to engage with all of you. And I'll turn it back to Ann to end this little update.
Shenanigan.
Yes.
Thank you. Thank you, Dr. Kirsch. Thank you, Dr. Clancy.
Thank you.
Really appreciate your leadership.